Welcome to the Egg Whisperer Show. I'm Dr. Amy. Every week, I'm here to bring you insights that help you feel more empowered and more connected on your fertility journey. Today's conversation is all about where science meets possibility. If you've ever wondered how artificial intelligence is shaping IVF labs and the future of embryology, this episode will give you a look behind the scenes of the technology guiding so many of today's breakthroughs. This week's episode is called How AI is Transforming IVF Labs with Dr. Tex VerMilyea. My guest is Dr. Tex VerMilyea, the Vice President of Scientific Advancement for U.S. Fertility and Ovation IVF Laboratories. He's a leader in the IVF research community known for pioneering collaborative studies in AI for embryo assessment and for his work advancing laboratory practices across a nationwide network of fertility centers. He brings a rare blend of molecular science, embryology, and operational leadership that's shaping how patients experience fertility care today. Tex, welcome to the show.
Thank you very much. Pleasure to be here. Thank you for the invitation.
I was so excited that you accepted our invitation. I've been wanting to talk to you for so long. You couldn't be coming on at a better time. And you've built this remarkable career spanning epigenetics, molecular embryology, and now leadership across U.S. fertility and Ovation. What first pulled you into this field and what kept you here?
Truth be told, I went to university thinking I was going to be a veterinarian. So I majored in animal science, but along the way, something called organic chemistry made me take a bit of a detour. So I was very, very good in the lab, but to lecture and conceptually, I couldn't hack it. So therefore, I had to think of an alternative. And at that time, I was washing bottles in the animal science reproduction lab, and just kind of fell into bovine embryology and working with cow eggs and bull sperm. And luckily had an internship during university in the human embryology laboratory, and just fell right into human IVF. And the rest is history since then.
Yeah, I remember those days washing those bottles in organic chemistry lab. Well, we're all so lucky that you ended up where you ended up. And you trained in labs across the US, the UK, Japan, with a foundation in animal science, like you shared, gene expression and chromatin research as well. How did that scientific background shape your perspective when you transitioned into clinical IVF?
The animal is a great model, especially in reproduction and how we learn how to do things, not only in the laboratory, but just in general, just biology. And I kind of went down the course of thinking I was still going to stay within the animal space, but had exposure to human IVF lab and was able to make it that transition pretty quickly. In addition to just working with people and seeing the fruits of our labor when it came to creating babies, creating lives, creating family. Did a bit of a detour during my PhD and worked back in the mouse model, but then decided, I really miss that human interaction and working with people and working at the bench and the human side of things. So transitioned back into human IVF and haven't looked back since. Still do some animal work on the side, but yeah, mostly it's full steam ahead in the human world.
I love it. So you've worked hands-on as an embryologist at the bench and now collaborate with labs nationwide and globally. How has that combination of roles informed the way you evaluate systems, outcomes, and best practices?
Well, I started off in the laboratory and at the bench. So I think I've been in the trenches with fellow embryologists and fellow lab folks. And so I know what it takes in the laboratory to do the hands-on work. My focus now is, how can we do that work better? What technologies can we use? And luckily I've been exposed to a lot of technology across the world and trying to hone that in and bring that into the laboratory to basically, make our jobs in the lab a bit easier, but also try to reduce risk in the long run, improving pregnancy outcomes. So I think, with the background of being at the bench, using my hands, sitting at the microscope for hours and hours and hours, trying to figure out what sort of technologies can be implemented in a non-invasive approach to help us do our jobs better in the lab. And that's kind of been my focus in the last few years.
And you've led award-nominated research on AI in IVF. How do you explain AI's current role in IVF and why it matters for patients trying to get pregnant?
AI is all around us. People using ChatGPT, people speaking to Alexa, maybe some are on their dating apps, swiping left and right? It's all artificial intelligence. And even if we're not aware of it, we're surrounded by it. Taking that technology and bringing that into the laboratory has been a big step, a big process where we've had to do a lot of data validation, but just trying to understand how can we take a simple image of an embryo on day 5 or day 6 and compare that image to hundreds and thousands of other photos similar to that embryo that have led to pregnancy success. So how can we do that non-invasively by just simply taking a picture of an embryo, which we do already, but running that through software to help us identify key features that we as humans can't identify when we're looking down the microscope. We're very subjective in our assessments. When people ask about, well, what grade of the embryo, what is the morphological grade? That's my grading as a human, right? So I'm looking down the microscope and we can see key features of the embryo and be able to assign a score, but it's extremely subjective. So how can we use technology to make that assessment more objective? And perhaps more accurate. So there's a lot of realms of AI, not only just in embryo selection, but also sperm selection, trying to identify that one sperm that is the healthiest of the cohort of sperm, but also using artificial intelligence to deep dive in our data and help us make data-driven decisions and hopefully, in the long run, trying to improve pregnancy success. That's what it's kind of all about.
Right. And is that happening now where people are using AI to look at embryos and using that information to guide them as far as which embryo to transfer?
So globally, it is, yes. In the United States, we've got something called the FDA, and a lot of this technology still needs FDA approval. So we're kind of working with other companies to, push that forward and do some large randomized controlled trials, which have indeed showed an improvement in pregnancy success by using this technology. But, we're treading carefully just with regulatory bodies. But in the rest of the world where there's not so much restrictions, AI is being routinely used, but we hope to someday be able to use it as a tool in our toolbox, as an adjunct decision motivator, or help us make better decisions, basically. And that's
Yeah.
the real key point of a lot of that AI technology.
Right. Do you think that it would potentially replace doing, let's say, PGT and embryo biopsy for embryos?
There's been a lot of studies showing that. We've done quite a bit, and I've published on that as well by getting pretty close. Now, it's genetics and chromosomes, that's biological, and it's going to be very, very hard to mimic that. But some early studies have shown that you can get pretty close to identifying which embryo is chromosomally normal just based on some morphological features that AI can pick up that we can't see with our human eyes.
Right. And do you think that there will ever be like a patient facing software, maybe even ChatGPT at some point can do this, where a patient could upload a photo of their embryo, or is it more complicated than that?
I think that's certainly a way that the technology is going. Routinely in the laboratory, and a lot of the software that we're using now is just a static 2D image, just like a picture of an embryo that a patient may receive at the time of embryo transfer. Obviously, we'd want to do that assessment before the embryo is transferred. I don't know if it become the day where post-transfer a patient, loads up that embryo and says, "Hey, what's my chances of pregnancy?" We hope to do that on the front end, but that technology and just the usability of the patient's ability to use that technology is certainly coming to the forefront, especially when it
Yeah.
comes to just better treatment and care management.
Yeah. And I think, correct me if I'm wrong, a lot of your work also is helping improve operations, reviewing procedures and outcomes across many IVF labs, and many is an understatement. What trends are emerging, and how is technology helping labs raise the standard of care?
Yeah, so like I mentioned, the data analytics that AI is able to basically take a lot of unstructured data and put it in a more palatable, structured form, so that we can identify best practices, look at our key performance indicators, our KPIs, and allows us just to streamline processes in the laboratory and also identify where perhaps maybe we're slacking a little bit, or where we can improve, or also identify what's working really well so that we can therefore replicate that across our laboratories. When AI in general, you think of taking a picture and trying to identify, which one is better. It's the same thing can be applied to data management and as well as, workflow processes within the laboratory.
Do you think that AI will allow clinics to accept more volume because it's improving things on from an efficiency standpoint?
I do. I think the workflow efficiencies that AI will bring into the laboratory, in addition to robotics, will allow us to better serve populations and hopefully underserved populations where access is a bit more limited. But, a lot of times with IVF, the laboratory can be seen as the bottleneck because we just aren't able to bring as many patients through or do as many retrievals, or limitation on laboratory equipment and personnel. So I do think that AI will be able to raise the bar when it comes to just the volume that we're able to put through our laboratories and hopefully, serve more patients in the long run.
Yeah. Do you think that there could ever be a robot that could do egg retrievals, like a robotic egg retrieval, like a robotic arm, the Da Vinci?
I think it's certainly possible. I'm aware of some companies that have already started doing robotic dish making, ICSI, embryo culture, freezing. There's a lot of new technology with microfluidics, whereby you simply pour in the follicular fluid in the machine and it will identify and find eggs that perhaps a human may miss under the microscope. That technology is certainly evolving. And again, I think when you bundle that all together within the laboratory, we're going to be able to serve more patients, hopefully.
You've published extensively. We've already talked a little bit about non-invasive approaches in IVF. Which of these developments do you think will have the biggest impact on patient experience in the coming years?
I'm very keen on improving the patient experience and the patient engagement. I think it's as a patient going to an IVF laboratory, going to a fertility clinic, dropping off your eggs, dropping off your sperm, and then coming back, getting a phone call in 5 days saying, "Hey, you have an embryo," and then you froze a few, and in a month later you come back for an embryo transfer. There's a lot of gaps in that treatment. So if we're able to use technology to not only better educate, but just allow patients to be part of that process, whether it's through perhaps time-lapse technology where patients can watch the embryos grow and divide, whether or not it's through a chat GBT or a AI agent that can talk to the patient when they have questions that are the answers are validated by an embryologist and by a laboratorian. I think that sort of technology we're going to see a lot more. We're iPhone generation where face to face like what we're doing now is pretty non-existent now, but I think through technology to better improve those experiences will certainly be coming more to real life,
Yeah.
in addition to, again, this non-invasive approach to embryo and sperm selection and egg selection potentially.
Yeah, I agree. I feel like with more technology, people are getting less human contact. And so the trend in the Bay Area is you do your egg retrieval, you find out how many eggs, and then basically on day 7, you find out what happened. I give a day 0 report, day 1, day 3, day 5, day 6, day 7, sending reports, calling patients, reviewing it. I haven't created an avatar quite yet to explain it, but I think that patients want that information. I do have patients sometimes that actually say, "Amy, I'm gonna be better off. Just don't tell me anything. It's just too
Right.
much for me. Just give me an update on day 7." But I think it's nice for patients to have the option. But a lot of centers,
Absolutely.
they don't give patients the option, and I get it. When you have so many patients going through, it's very difficult for the doctor to take the time to go through everyone's results with them that day. And I think it's better to have someone who knows what they're talking about than, let's say, someone who's well-intentioned in the clinic. And I've seen this before where like a medical assistant will share the information and that can cause more confusion for the patient. So I couldn't agree with you more. Anything that can help patients just feel heard and feel like they're a part of the process rather than like an outsider not understanding what's going on as it's happening is great. Let's talk more about advanced technologies in the lab. So, you've worked with tech involving sperm selection, robotics, pregnancy prediction with data optimization. So, how will this tech impact the overall patient experience?
Maybe we start with pregnancy prediction. So again, using massive amounts of data and trying to find similarities of particular patients and match to other patients with success and without success, being able to give patients a more thorough understanding of what is their likelihood of getting pregnant. Is it going to take one retrieval? Is it going to take two retrievals? Do they need 5 eggs or 20 eggs? Is it a waste of time to do IUIs and should they go straight to IVF? This kind of prediction will hopefully allow patients to be served sooner, get the treatment that they need quicker, because as we all know, the clock is ticking, and we definitely want to use these sort of technologies to decrease the time to pregnancy. In addition to the pregnancy prediction and the data mining, robotics it's at our forefront. You think through the assembly line of making vehicles, where it was very much manual welders on the assembly line, and now it's all moved to robotics. And yes, humans, we can do a pretty good job, but unfortunately, as humans, we're not as consistent as perhaps a robot is and accurate at sometimes. So, how can we use that technology to reduce risk, to reduce potential mistakes, but also improve outcomes and perhaps do it better? So, we're now looking at the robots that are potentially coming to IVF laboratories and not necessarily doing the entire procedure, although there are some. What are some of the mundane tasks within the IVF lab that can be done by a robot or done by artificial intelligence that allows the human to then use their skill sets as an embryologist on something better or something different? I always say you can never take the art out of ART. And I think it will always require a bit of a human touch, especially with some of the fine finesse skills that we use in the laboratory. But it's exciting to see where this technology is coming down the pipeline. And I think and I hope will soon be in IVF laboratories and part of standard of care.
Yeah, that's exciting. I also say technology is only as good as the human power behind it. And
Correct.
so we can never say that nothing is risk-free because there's always a human behind it. But with the support of the technology that you're mentioning, I think IVF labs could be even more successful than they are today.
That is the
And
hope.
yeah, yeah. And you've championed selective single embryo transfer. And luckily, that's the culture now in most, if not all, IVF labs in the United States, if not worldwide. What do you want patients to know about how laboratories balance success rates with safety?
Yeah, that's at the top of our minds, and basically, every egg that comes through the laboratory, we want to decrease the time to pregnancy. And back in the days when the technology maybe wasn't as advanced as it is now, or our procedures and processes in the laboratory were not as successful as they are now, we would put back multiple embryos and roll the dice and hope that only one would take, but sometimes multiple would take. And if anything, I've learned in this field, two is not necessarily as good as one. And we want to be able to make sure that the patient has a success with an embryo transfer, but also not put them at risk or the potential child at risk by putting more embryos back in the uterus. So, using again technology to help us streamline and better identify which one, two, or three embryos are the most prime or the ones most capable of leading to a pregnancy. That's really our aim. PGT and the ability to count chromosomes and identify which embryos are chromosomally normal or have the correct number of chromosomes, that certainly has allowed us to pre-select or triage which embryos to transfer first. But in addition to that, maybe we can use AI technologies, and there are other non-invasive approaches that we can help identify which one good embryo is going to lead to a baby, and then potentially maybe there's more. And with vitrification and with freezing, we've got some backups in the freezer to come back to in case we have a failure, or if the patient decides to continue on their family building journey.
I had an idea. This was years ago. Someone else has built it, and it's AI for the ultrasound machine, right? So you
Mhm.
just put the probe in, push a button, it scans everything, and then spits out a report. Do you see anything coming in the future for doing ultrasounds?
There are some softwares, yeah, exactly, that you mentioned. I think with a lot of this technology, it's only going to get better. And I
Yeah.
keep telling myself that. So we have to be patient with some of it. And AI is also built on retraining that algorithm, right? And retraining that process. So even though, let's say, we validated the data and it looks pretty good when we're comparing that one embryo or that one sperm to 100,000 photos. Well, as we continue to use it, that 100,000 is going to become 200,000, three hundred
Mhm.
thousand, and all that's going to do is allow us to better identify that data and redefine that algorithm. And just not that it's going to be perfect, but it's going to continue to learn and continue to change. So yes, there are some ultrasound AI companies that again will hopefully lead to more accurate and as well as speed up the process in the clinic.
I think hopefully in the future there will be a company that will actually rent patients a probe. They can do it from home. And I know that there's a company like that already. And then more people could have access to care, especially patients that live in fertility clinic deserts where there's like no one around them for like hours and hours.
Absolutely. Yep.
Yeah. So, what do you wish that patients or fertility doctors better understood about embryology and IVF labs?
There's a lot of Googling, shall we say, about what goes on in the laboratory, and I think education is key. We've often had patients produce that photo at time of frozen embryo transfer and beautiful blastocysts at time of freezing, and that embryo is still starting to expand, so it still looks like a potential raisin in this moon outer layer. And the patient goes home, they go to Google Doctor, and compare images, and hey, this isn't a blastocyst. This looks like a raisin. And then we're having to have that conversation of like the embryo was frozen. It is now starting to warm up and thaw, and it will eventually re-expand. Don't overthink it or get too worried. But I'm keen to help educate and provide answers to those sort of questions. But sometimes too much information is not going to be helpful. So I think be inquisitive in your journey. The embryologists are extremely well trained, and we're the best satisfaction we have is when a patient does get pregnant, or even if a patient gets an embryo and they've never
Right.
been able to have an embryo and have that opportunity. But we're really, really good at what we do, and again, layering on that technology, we're only going to hopefully do things better and more efficiently. And I think the physicians, they understand who butters their bread, and that's the lab team.
Oh,
Where
so true.
sometimes we're back in the dungeon and closed off to life in general, but we get with it. We really work well at the bench, and really have a passion for what we do. And if you have that patient experience and that interaction, it's obviously a bonus to our jobs. But at the end of the day, we come to work ready to make embryos, to build embryos, and that's just what gives us great satisfaction.
Yeah, we do a lot of cheering of our embryologists. We clap for them after the embryo transfer.
That's awesome.
It's just a natural thing. We're like, "Thank you."
Yeah, we
They
need we
do
need more
such
of
a
that.
great
Yeah,
job. Yeah, and I've listened because so many patients record their transfers, and then sometimes they'll send me the video. Look at the video, and you can hear us going, "Woohoo!" And it's
cheering it
it's
on.
fun.
That's great.
Yeah,
That's great.
it's fun.
Well,
Yeah.
appreciate you
Um,
doing that.
yeah. What I'm curious about is what your thoughts are on what the IVF lab will look like in 5 or even 10 years from now.
The lab has already evolved so much. Equipment has gotten smaller. We've using equipment that is now more so built for embryology versus large cell culture. The big box incubators where you'd see in research laboratories and everywhere else. And now we've got this small footprint shoebox size incubators. Some of them have a camera attached to it that does time lapse and takes a picture every 5 minutes and makes a video of the embryo growing. So we can go back and look at these morphological events. I think the next 5 years were probably in the U.S., depending on how the FDA views some of these technologies. I think it's going to be a lot more automated and the process a bit more quicker. Not so much the embryo growing quicker, but just in general, just the treatment plan. I think there's going to be a lot of crosstalk between the clinic and laboratory, and sort of a better interaction there that allows positive feedback or just more feedback and discussion between the two, and really making a joint decision on best treatment care. And in 10 years, yeah, maybe there are robots. uh, the fear for embryologists is that AI and robots are going to replace us and we're not going to be needed. And I highly disagree with that. Maybe it's true our skill set may change. Maybe we're becoming more biologists and engineers or troubleshooters on the back end. But I think anything that can improve the process and not compromise results is certainly a win-win situation for everybody involved. So yeah, maybe in 20 years, it's going to be a hub and spoke model where patients freeze their eggs and collect their sperm at home, and they send it to a mother laboratory or mothership where the embryos are built. And then, who knows, maybe we're doing embryo transfers in your lazy boy in your chair at your house, and, van pulls up and we're able to do that. I have no idea, but, I think
I
access
mean,
to
that's
care is
I
certainly,
gotta tell
is
you,
certainly key.
that's not too far off because I've had folks reach out with that kind of model, like the mobile IVF clinic model,
Yep.
the same
Yes.
model that you're just sharing. And I also have thought because fertility is now so important, obviously now more than ever, just because of what we're seeing in the world and society and those trends as far as people delaying childbearing, that people might even have their own tanks at home
Yeah.
for long-term storage. Potentially, there might be like, like your Alhambra water comes once a week to drop off your water. They'll come in and just charge your tank at home for your embryos. Who
Very
knows?
possible. Yep. Very possible. Yep.
I know it
I
sounds
would
out there,
agree.
but sometimes these ideas I have, they actually become a reality. I
There you
maybe
go.
not immediately, but we'll see. We'll
That's
see.
right.
Yeah. Yeah. So I've truly enjoyed this conversation. And for listeners who want to follow your work or learn more about you and what you're doing at US Fertility and Ovation, where can they find you?
So I've got a LinkedIn page, and Ovation Fertility and US Fertility has a research page that basically shows all of our publications and ongoing studies and engages the patient and educates to all the great things that we continue to do. Look for me at your national and international meetings, and you can always find me. I'm the only one there with a cowboy hat on. Pretty easy to find. We would like to push our research and scientific findings to help better improve the space, and again, giving the patients the best option and possibility for success.
Yeah. Do you think embryos like a certain kind of music in the IVF lab? Has AI figured out that to grow better?
I heard it's country music. So most of my labs play country music, so we keep it at that.
I love that. Tex, thank you for joining me today and thank you for sharing your work. All the links we've talked about will be in the show notes. If you've enjoyed this episode, remember to subscribe to the Egg Whisperer Show on YouTube and Spotify. Keep moving forward with hope, keep believing in your journey, and keep sparkling.